Welcome to Thoughts for Growth, your 5-minute or so spark to see our world differently. Brought to you on Mondays, Wednesdays, and Fridays by K-Wave 6 Radio. Now, here's today's thought.
Think of the future that we could create. Face the facts today. There's a better way. There's a better way.
Over the past few days, I've been posting things on my Facebook wall about Ebola and the possible spread over here in the United States. Since Timothy Duncan came here, it has been spreading. I take that back. Even before Timothy Duncan was found to have had Ebola, a journalist came back over here from Africa that had been reporting on the situation over there. And he came back over here to the United States with symptoms to Nebraska. He was put in Nebraska hospital. Apparently he's doing better and healing and recovering from it. That's wonderful. But why was he allowed to come back over here into the United States knowing that he had been in the area with Ebola? The same with Mr. Duncan. Why was he allowed here in the United States knowing that he had come from Africa? I've heard different stories that he did not tell them where he came from, and I've heard that he did tell the nurses where he came from. He sat in the hospital waiting room for 4 hours, possibly exposing, who knows how many other people to the virus with his presence there. He should have been isolated. He wasn't. We can't change that. We can't go back in time and move him off into another room, give him different treatment, whatever. But the hospital and the nurses, the doctors, everyone else knew that Ebola was present. There was a possibility that it could be coming to the United States. Since that time, there have been other people now. There are 2 nurses that have found to have it. One traveled to Ohio, which I cannot understand, first of all, why she would travel knowing that she had a fever, why she would be allowed to travel. The CDC apparently told her that it was okay for her to travel. That was stupid on their part and on her part. So now because of that, more people are being quarantined, more people have a chance of having the virus, people on the airplane, the people at the wedding shop, her friends that she went to Ohio to make plans for her wedding. Wonderful. Congratulations on getting married. But she could have made some of those arrangements online. She's not the first person to ever get married in the world. Not the first one to have made arrangements long distance. So I think that's pretty selfish of her to go in and travel and take the chance on exposing other people and her friends to the virus. It seems to me that a lot of the healthcare professionals, so-called professionals, because I'm really doubting the way some of them are handling this situation, they're not taking it serious. They know it's a deadly disease. They know they have come in contact with it, but they're not taking the proper precautions. Obviously, because it's being spread here in the United States. I've heard now that there is a case of a student in Yale. There's a case in California. California University was been shut down because of it, to keep it from being spread. Schools in Ohio, a couple of them were shut down to keep it from being spread because of this nurse going there. How can you expect everyday people to take this serious and to take proper precautions when people who work in the healthcare industry, and I have to name another one, Nancy Snyderman, she was exposed to it because of someone else in her journalism team. She's a medical professional. She does all these medical advisory things on, I believe it's MSNBC. She didn't even take it serious. She went out of self-imposed quarantine. Well, how the hell self-imposed is it when you go out whenever you want? So if she's supposed to be such a healthcare professional and expert on a lot of medical issues, then why didn't she take more precautions and take it more serious? So you really can't expect ordinary everyday people that aren't in the healthcare industry to take it serious or to take any precautions or anything else when the people who are supposed to be telling us how to handle this serious medical issue aren't taking it any more serious themselves, flying around the country and going out because they want to have soup at their favorite restaurant instead of having someone go out and bring it to them. That's selfish in my opinion. So, what can be done about these people? I don't know, but yeah, I think there needs to be repercussions on some of them. Miss Snyderman, she's, like I said before, she's supposed to be their medical expert on a lot of issues. I've seen her do several reports on things. Don't think I'll be listening and taking any advice from her in the future, not after this. So they really don't instill a lot of confidence in people when they don't follow their own advice and just do whatever they want. So I can't really say that ordinary people are spreading the virus over here. I'd have to say we have to watch out for the medical professionals more than anybody right now. What can we do about it? Wash your hands, cover your mouth when you cough, take extra precautions with your cleanliness. If you see anybody that's sick, try to stay away from them. You never know if they've got this or they've got that or some other virus, the introvirus. There's just so many things going around nowadays. So most that I can say is stay clean, wash your hands, cover your mouth when you cough, sneeze, etc. Be mindful of other people. If you don't feel good, don't go to work, stay home, keep your child home from school. Why take a chance on spreading something this deadly? God bless the people that have it. I hope that you recover. Anybody who's lost family and friends and anything, condolences and sorry for your loss. And, I just pray that they get this under control soon.
Think of the future that we